So let's say that you're with a client
Mhm.
and they're like explaining their side of the story. They're explaining their side of the story, kind of being one-sided about things. And then
Mhm.
they go, do you think I'm being unreasonable? As their therapist, how would you?
Right. So situations where that would typically come up would be if there's some kind of fight going on and the person is trying to like tell you like he said, she said of it. And then they're like, well, am I wrong? Which they really are polling for you to be like, tell me I'm right. And that's tough because, well, typically I try to kind of avoid that conversation. And I try to cut it off before we get there because it's not therapeutic to rehash
Right.
in a what we call is ruminating. Right? This is where you know like a cow, where you ruminate kind of one stomach to the next. To the next. Humans do this, where we think about something, and as we keep every time we go through the story, we reorganize and reconsolidate it till we self-radicalize ourselves. Where we go from like he's being a jerk to he's an asshole, he's the worst, he's abusing me, I'm a victim. So as therapists, we try to interrupt this rumination that people do because the thinking doesn't get clearer the more they go through it. The thinking gets more jumbled.